A new bill would give parents more access to kids' medical records. This includes conversations with doctors about things like sex and vaccines. WRAL state government reporter Paul Spey is here to discuss the details of this and really what it's going to mean for families.
That's right. Under the current law, someone under the age of 18 can go to a doctor and talk about depression, mental health, their sex lives if they're sexually active, and potential drug use. And it's all private. The parent does not necessarily have a right to be in the room when that happens.
Even any treatment that might be discussed.
That's right. They can also get treatment for those things from the doctor without needing a parent's permission.
And if this bill were to pass, how would things like that change?
Well, this bill, which they're calling the parents' medical bill of rights, would take out a lot of those protections and leave only things about pregnancy. So even if this bill passes and you're a minor and you get pregnant, you can still go to the doctor without needing your parents' permission. But the conversations about mental health, about substance abuse, about other sexual activity, as it relates to STDs, let's say, that would no longer be private. Your parent would have a right to be in the room, and even if they weren't there when you went to the doctor, they could access your medical records. That's something that the bill sponsors say isn't necessarily happening right now.
Now, lawmakers or parents that support this kind of feel like it's a no-brainer. They want to be involved. They don't want any secrets with their families and with their kids. But the people who are against it have pointed out some potential downsides. Can you explain a little bit of that?
Right. Well, I spoke to a representative from the ACLU earlier today, and they said that, if your kid is suffering from depression, let's say, or if they're sexually active and they don't really know how things work, it happens at a young age, you want your child to be able to speak openly and candidly with a physician so that they can get honest and accurate answers. Now, let's say you're 13. If your parents are in the room with you, are you going to be as open? Are you going to tell them about some of the activities you've been doing? Maybe not. And so if that doesn't happen, then young people aren't going to they're less likely to get the treatment they need.
So where do we think, what's the trajectory of this bill? What do we anticipate happens next?
Well, this doesn't appear to be necessarily Republican versus Democrat. This is shaping up to be something that's more on people who side with parents versus people who side with doctors in the medical community. And they have a big lobby down in Raleigh at the state capitol where, the hospital, now the Healthcare Association, and other doctors, they have a lot of sway, even with Republican legislators. So it's hard to tell whether or not this will actually be passed.
All right. We'll keep an eye on it, though. Thank you, Paul.
Thank you.